Kenyans in the rural areas may soon be forced to pay in cash to access services at private hospitals. Over 400 private hospitals will from next week not accept the National Health Insurance Fund cards. The Rural Private Hospitals Association of Kenya says dwindling settlements by NHIF and outstanding debt of 6.1 billion shillings is crippling services in most hospitals. NTV's Brian George kicks us off tonight.
With an outstanding 6.1 billion shillings debt by the National Hospital Insurance Fund to private hospitals in rural parts of the country, an estimated 400 hospitals will from Sunday not accept NHIF cards, and patients will have to pay for medical services in cash. The Rural Private Hospital Association of Kenya, RUPHA, revealed that NHIF owes them 2.3 billion shillings for general claims, 2 billion shillings for Linda Mama program, and 1.8 billion shillings for outpatient claims, a staggering amount that has crippled their operations. RUPHA further claims that NHIF has not been remitting money to these healthcare facilities until March, when it paid 56 million shillings to pay facilities that had pending capitation for the January to March quarter.
So with that, the payments that have been coming to hospitals since the Social Health Authority came in, that is from sometime in October or so last year, the payments have really been very, very, very small. So providers, generally are receiving something like 10% of what they are owed. So you find a provider who has claims of, let's say, 20 million shillings. They are not being paid anything more than 1 million shillings, so sometimes even less. Even 300,000, even 500,000 off.
The association's members had decided to opt out of NHIF until the transition to the Social Health Authority (SHA) is completed. This move means that patients will need to pay for healthcare services in cash, putting the Universal Healthcare UHC in a challenging spot. RUPHA chairman Dr. Lishega further says there has been no commitment, either the NHIF or the Ministry of Health, to pay the debts, which has further affected service delivery in rural hospitals. He expressed concerns over the transition to the new medical scheme, as the debt accumulated under NHIF might not be cleared.
In other words, the NHIF must sit down with providers, agree what is the liability, and agree what is being settled now. And if anything is to pass over to the Social Health Authority, it must be based on a legal sign-off that this is what you are owed as at this time. Both parties have agreed, and then we sign off.
At State House, Nairobi, where he met Kenya Kwanza MCS, President William Ruto was confident that the Social Health Insurance Fund will revolutionize public health insurance in the country.
Wale watu wanalipishwa 500 na mapato yao iko chini, tunataka turudishe ikuje 300. Wale watu indigents, wale hawana kabisa uwezo, wale watu maskini, tunataka kuwalipia kama serikali.
RUPHA also raised concerns over what it termed as biases whenever any money is available, saying NHIF prioritizes payments to levels 5 and 6 hospitals, an approach it opposes. Brian George, Otieno, NTV, Nairobi.